All right, I see that we're starting to broadcast and welcome in participants. So welcome. We'll wait a little bit till folks get settled in. We've got quite a number of attendees registered for today, which is exciting. I think it shows how much interest folks have in this topic and wanting to hear from experts on the ground. So thank you all for joining in, pouring in, and I'll wait just a little bit until we kind of maybe let's wait till we get to, let's say, 100 or close to 100, and we'll kind of get started. And just for those of you who are joining us right now, you're probably very used to all the Zoom features from this summer and this year where we've all kind of been learning and engaging virtually. We've got the chat function, which we want to encourage you to use should you want to just sort of give some praise, connect with other attendees, also to hear read alerts from the Venice Family Clinic as well. We'll use a chat function for that. Now, say you have questions for the panelists as we continue with our conversation and want to perhaps get answers from them if it's not already sort of touched on in our moderated conversation. I want to encourage you to do so using the Q&A function. So good afternoon, and thank you everyone for joining us today. As you may know, today marks the 4th installment of the Venice Family Clinic's Health and Justice series. And our panel conversation today focuses on birth in the USA, maternal mortality in communities of color. I'm your moderator, Gabrielle Horton, an Inglewood native, podcast host and producer, most recently of Natal, a podcast docuseries about having a baby while Black. And I'm really excited to be here with you today, especially because of the 3 wonderful experts and healthcare workers that we have with us today to talk about not just the problems that we all hear so much about when it comes to birthing in communities of color. Thank you everyone for joining us today. As you may know, today marks the 4th installment of the Venice Family Clinic's Health and Justice series. And our panel conversation today focuses on birth in the USA, maternal mortality in communities of color. I'm your moderator, Gabrielle Horton, an Inglewood native, podcast host and producer, most recently of Natal, a podcast docuseries about having a baby while Black. And I'm really excited to be here with you today, especially because of the 3 wonderful experts and healthcare workers that we have with us today to talk about not just the problems that we all hear so much about when it comes to birthing in communities of color, but to talk about the solutions that they're helping to shepherd, right? And that's what I get really excited about, and I hope you all are too, because they've got a wealth of knowledge to share with us today. So first, and in no particular order, because they're all just so phenomenal in their own right, we've got Kimberly Durden, an award-winning lactation consultant, student midwife, childbirth, educator, and doula. In March 2018, Kimberly and her business partner, Allegra Hill, opened up Kindred Space LA, a birth, lactation, and education space right here in Los Angeles. Kindred Space is also home to the Birthing People Foundation, a nonprofit they co-founded to train more birth workers of color. And don't worry, we're definitely going to talk to Kimberly about what's going on over there, because it's some exciting work happening. Next, we've got Dr. Kennetha Gaines, the Director of Nursing at Venice Family Clinic. She has a strong background in providing clinical leadership and expertise, focusing on mother and newborn infant care, specifically with an emphasis on perinatal outcomes such as cesarean sections, inductions, and breastfeeding rates for low-income women of color. Kennetha's experience includes nursing leadership throughout the care spectrum for various metropolitan hospitals and community clinics. Last but certainly not least is Dr. Lisa A. Nicholas, who has been a practicing physician devoted to obstetrics and gynecology for the past 30 years. She has dedicated her career to providing quality health care to women of all ages, regardless of race, ethnicity, and also income status as well. She's originally from Buffalo, New York, where she earned her medical degree, and she later eventually moved out west, and started working at the MLK Hospital in South Central Los Angeles. Her varied experience in clinical practice also includes administering direct patient care in private practice, multi-specialty medical groups, and community-based clinic settings. In addition, she's got a proficiency and has a wealth of experience in supervision and training of medical personnel, something we're also going to touch on because that's such a critical part of this work as well. And also thinking about how to train up students and other healthcare professionals coming into this work. Dr. Nicholas has been recognized as demonstrating exceptional analytic, reporting, and diagnostic skills with a focus on patient satisfaction. So I am so excited to be here with all of you today. And just a final housekeeping for those of you who have just joined us, We will be having a moderated conversation for about the first 40 minutes or so. So feel free to use the Q&A function to pose questions to the panelists, say you need clarity on something, want to hear more, want to dive deeper. Use the Q&A feature. We'll make sure we answer your questions that way. And then use the chat function if you want to sort of just give a, snaps, thumbs up, I love that, share some love with each other, give some praise. Also, you'll want to note there's some alerts that will be happening in the chat section as well, including if you feel the spirit moves you, is what I say, feel free to donate today, because that money is going to be split equally between the Venice Family Clinic and Birthing People Foundation, which Kimberly heads up alongside her co-founder, Allegra Hill. So let's dive in, because we have a lot to talk about. Welcome, welcome, welcome. How are all of you doing today?
Doing very well.
Yeah.
Thank you.
I know it's a weird time, and I feel like we have so much to cover. I feel like this year alone has ripped off so many band-aids, has revealed so much of what I'm sure all of you have already known to be true. So I guess let's just start there. What does birthing in the USA look like for families of color in 2020? And it may not be different than before, but I think that this year is maybe a little different, maybe not. Kimberly, do you want to start and let us know, what does it look like from your perspective as a birth worker, someone leading this work and training up younger birth workers as well?
Well, thank you, Gabrielle, for passing the mic to me and putting me on the spot to go first. I have a lot to say on this topic, so I'm happy to speak on it. And I'd also like to just give a shout out to the folks that are here, Kennetha and Dr. Nicholas. So glad to be on a panel with you. Funny enough, I had a person call me that is pregnant and who was asking a lot of questions about birth doula care and things like that. She had been referred by a prior client of mine. And as she started describing, she's a woman of color and a woman of size, and she started describing her experience with her current OB, all I could say to her was, your OB sounds great. Like, they're giving you all the information you need to know. They're really, answering all your questions and helping you feel like more comfortable with this experience. And I was like, what's their name? And and she told me, and as she told me, I started looking at who was going to be on the panel today, and it was actually Dr. Nicholas. So I was like, oh, how ironic, that we would be having this conversation, and I would realize that we were going to be speaking together. And I think that even though, like you said, Gabrielle, birthing Black families and Black individuals birthing has been a challenge in our system for quite some time. It's nothing new. We're getting more reports on it and more news stories, but this is something that we've been dealing with for a long time. And I think that COVID definitely pushed more of the disparities to the forefront as we started seeing that folks were not being able to have support in the hospitals any longer, that virtual visits, are they the same, and do they give us the same quality of care as in-person visits? Partners not being able to be involved in prenatal visits, and all the things just seem to get a lot tougher for us in COVID times. Right. That said, I have to say, for a person, and I am a licensed midwife right now. I think my bio said student midwife, and I was a student midwife for a really long time. So, but as a licensed midwife, as COVID hit, I would say March, when we started really understanding what was happening, our phones began ringing off the hook for the type of services that we provide, which are out-of-hospital services. Yeah. And really, we had a big uptick in interest in what we do, which is a good thing. And so it leaves us as providers scrambling to figure out how to support more people, especially people of color.
Right. Thank you. I feel like that may be a natural segue to you, Dr. Nicholas. I'd love to hear your thoughts as someone who is sort of, affiliated with UCLA Health and thinking about your role as an OB-GYN. How have you been sort of navigating through this year, ushering in births and kind of walking alongside patients and their partners and their families, thinking about sort of giving birth during this time? What has stood out for you, whether that's good, bad, or sort of in between?
Well, thank you very much, Gabrielle and Kimberly. Thank you so much for those kind and reassuring words, because, I really want and committed to making sure that all my patients really have the opportunity to connect with me. But there was one thing one of my patients had shared with me just a couple of weeks ago that really got me thinking. And she says, Dr. Nicholas, I'm afraid. I'm afraid. And her husband says, you know, it's not a safe place for women in our healthcare system that look like me. And there are many women that feel that way. Their partners feel that way. In this country, a woman of color should not be afraid of going into a healthcare system, such as a sophisticated system that we have here in Los Angeles, and feel that they're not being heard, they're not being treated fairly or equally, and they're not going to get the standard of care that they deserve. But nonetheless, we find ourselves in this situation in 2020. Many of our patients are really looking for alternative ways and locations to have their babies. There's been an upsurge of interest in home birth situations. Am I right, Kimberly, with that?
Oh, yeah.
Yes, I mean, there's really been an upsurge in that. And, you know, my thought is I want my mothers to be safe. I want my babies to be safe. I want my families to feel happy and have their experience the way it really needs to be. But the way our system now is not facilitating that. And there has got to be a change. COVID has lifted the curtain on all of this.
Yes.
And I'm glad we're here having this conversation.
Oh, we've got so much to dive into, but before so, Dr. Gaines, I want to hear from you, especially thinking about sort of like your extensive leadership in the nursing space, right? Even thinking about the makeup of hospitals, thinking about sort of the faces that many families are going to see on a regular basis, right? As the OB-GYN is kind of making their rounds to their patients at the time. Oftentimes nurses have a lot of close contact and those sort of in that sort of spectrum, right, of care. And so would love to hear from you about how this year has maybe stood out to you. Again, the positive or challenging or in between sort of experiences that really stand out to you when you think about 2020.
Yes, Gabrielle, thank you so much for having me here. And I'm so happy to be here amongst a group of very strong women and really talking about these important issues. And, you know, birthing in the United States and during COVID times has been complicated. So, you know, many cities and counties, they've actually been offering free doula services specifically for African-American women in an attempt to have someone with them in their birth so that they can listen to their needs and be advocates for them. And there's a lot of research around this that shows that this continuous labor support can actually have positive impacts on birthing outcomes with regards to pain medication, their birth experience, and even differences in their APGAR scores. So, but things have been complicated because of COVID. Right. So according to the Listening to Mothers California survey, so this is a recent survey that was put out, almost a third of African-American mothers reported that they did not feel that the delivery room staff encouraged them to make decisions about their birth progression. And more than 10% of these women also reported that they felt like they were treated unfairly during their hospital stay because of the race or ethnicity. And historically, this has been a major concern for African-American women in our healthcare system, which is largely stemmed from systemic racism, implicit bias. So after Governor Newsom's mandatory stay-at-home order, this really complicated things, and a lot of birthing facilities had to implement restrictions on visitors. And so some didn't allow any, some allowed one, and this really put women in a very precarious situation because they had to choose either from their partner or from their doula. And so given this unacceptable, and when we're talking about, we'll get more into maternal and infant mortality, we need to do something better, and we need to have alternatives in place because this just complicates things from a system that's already been complicated. And so really looking at alternatives and how we can improve that for our moms.
You all touched on a number of issues and topics that I have been eager to sort of talk with you all about, and I'm sure a lot of our attendees are, you know, quite interested in hearing your thoughts on. But I think that, you know, you all each kind of brought up sort of thinking about and how to incorporate and honor parents' desire for alternative birthing spaces, right? And I'm curious about how you all are approaching that, giving sort of like the sort of like historic lack of underinvestment in like the home birth sort of space, right? And then now all of a sudden, you know, you've got families and individuals and parents afraid to sort of be in hospitals, right? And so I'm trying to think about some of the solutions that you all individually, but probably more so affiliated with your organizations, have tried to sort of initiate or uphold to kind of make these sort of alternative sort of options more norm. So what does it look like for you, Dr. Nicholas, to work with, say, birth workers, or to kind of help coordinate your families having like an at-home birth or having sort of midwife support? I just want folks to have like a tangible sense of what some of these solutions have looked like for you all in real time, as we're all finding out more about COVID, literally as each day goes by. But we've still got families ready to birth, ready to pop out and give birth to babies. So I'd love to hear more about some of the either tough decisions you all have had to make to kind of negotiate, and maybe if you have an example of how you've had to sort of do something a little bit different to kind of create a safe environment for families of color. And I typically, just as a note for this conversation, I know it's communities of color, but I also noticed you guys are talking specifically about Black families too, and that's fine. So I just want to make sure our attendees sort of hear the difference as well when we're talking about Black families, Black pregnant folks, and when we're talking about communities of color at large. So if any of you want to share an example, or even just hard decisions that you are maybe even still wading through to make these alternative spaces more of the norm and safe for your families.
Right. Well, one of the things that I talk to my patients about is really utilizing the services of the doula. I find the doulas are really fabulous in regards to really helping and being that very, very important voice that needs to be heard as it relates to the actual birthing experience and process. Sometimes it's very hard for the partner itself to really advocate for the patient because it's such an emotional experience. They may not know when and why and how to speak up, but the doulas do.
Right.
So in this COVID impacted time, there has to be restrictions in regards to the number of people that we actually can have in the laboring area. So we use smart devices, tablets, and keep those lines of communication open at all times. And many of the doulas are really able to avail themselves to be available for the patients during these kind of alternative ways. So that's one way that we've been trying to segue into enabling that extra person being there.
Right.
Hopefully at some point, if we can get a handle on this COVID, we'll be able to bring them actually back into the labor and delivery room, which obviously is the optimal situation. Now, as it relates to alternative birth experiences in birthing centers, I encourage my patients to do their homework, look at the statistics, ask questions, and make sure that there is a backup situation in the event that the home birth is not going to be successful, because sometimes we can't predict which patients may really get into trouble, and it could happen within a flash. And there needs to be a mechanism to really have the patient and the family get to, a hospital setting where alternative support measures may be indicated.
Absolutely.
So there always should be some backup system that with a hospital type of situation. Am I correct, Kimberly, with regards to these birthing centers? And that's what I ask them to do. But I believe in supporting my patients wherever they are. I see them where they are. I respect them for where they are. And my role as a physician in my years of experience is just to tell the truth.
Yeah.
Tell it as I see it.
Yes.
And then, that becomes a negotiation. And if a person is clearly high risk to me, and I can see that this person may be placing herself or her baby in jeopardy, I will openly disclose that.
Yeah. Kimberly, I feel like that was a call and response kind of happening to get your thoughts, right?
I'm very much a part of my African-American roots, and I'd love, we kind of cut in and talk and do all that. I'm trying to be,
You're good.
Hold it until everyone is done. But yes, everything that Dr. Nicholas said, I totally agree with. I do want to say that I think that what would be helpful if we had a better understanding of what folks such as myself, licensed midwives, do and how we practice. Number one, we work with low risk people. We work with people who are low risk. It is out of our scope to work with anyone high risk. As well, if we have a low risk person who suddenly becomes high risk during the prenatal period or in the labor, absolutely. It's actually as part of our mandate and written into our bylaws that we must have a backup plan. And that's something that we discuss with our clients through and throughout the pregnancy, whether it be through the client's own relationships with the medical provider or our own relationship with medical providers. One of the things I'm really excited about is that we have some wonderful medical providers. I mean, honestly, I'm going to be straight up and I'm going to tell like the truth and tell it like it is too. Home birth has been a very dirty word for a very long time. And I think that COVID, one of the blessings of COVID is that it helped a larger number of people see like, oh, understand why somebody would give birth outside of the hospital and give more attention to actually what we do. We in Los Angeles or in California, in order to practice as a midwife, you have to be licensed. You have to jump through a tremendous amount of hoops. I mean, I just finished jumping through a ton of hoops and to get here. And we are very comfortable with normal, and we are not, as I said, we're at high risk is out of our scope.
Right.
That said, we also know that there's lots of different ways to help people feel supported. Not everyone is a home birth candidate. Not everyone is a birth center candidate. Many people are. However, there are other, for folks who have to birth in the hospital, that shouldn't mean that they can't be supported. I agree with Dr. Nicholas that doulas or birth workers are so important to our clients, to our healthcare system. They are wonderful advocates. I think that our American culture doesn't do a good job of teaching parents to be about the fact that they need to kind of learn about the pregnancy, take childbirth education, learn about breastfeeding, all before they have their baby. That Dr. Nicholas's job is not to teach you childbirth education. That's actually something that you should be doing on your own and figuring out how to get that knowledge. And I think that a lot of us have this idea that our doctors are going to teach us everything when we go into labor, like they're going to tell us everything. And it doesn't work that way. The system is not set up that way. Our medical professionals don't have time like that, primarily because of how the system is set up. And so we have to I really want to put some of the responsibility, a lot of the responsibility on the patients / clients themselves. They have to take charge of their birthing experience and get the knowledge and find the support and do all those things and not expect. I mean, I say sometimes that people spend more time researching what type of car they're going to buy or what type of wedding planner they want to use for their wedding than they do in researching their OB or researching their medical professionals and finding out about what do I need to know before I bring, to have a healthy pregnancy.
Right.
What do I need to do? What do I have to change? What do I have to embrace? What do I have to let go of? And then what is labor? And what is that going to be like? And how can people support me? And then postpartum. I mean, that's another huge area that I know that probably won't have a tremendous amount of time to get into. But when we talk about mood disorders, maternal mental health, the family's mental health, I mean, all of that, that gets impacted from postpartum, in particular, if you're not prepared for what happens after you push the baby out. Okay. So Dr. Nicholas is not going to go home with you after you have your baby and teach you how to do all that. You have to get your support system together, and we have to really, really take charge. Don't wait for someone else to tell you. Educate yourself and become an advocate and figure out who you need to have around you so that wherever you birth, that you can have an empowered experience, an informed experience.
I love that. And Dr. Gaines, before you go and answer that, I have another question that's kind of an offshoot of this, and I think that I'd be really interested to hear your thoughts, and I think attendees could really benefit from. So some of the things that you guys have already started to bring up is thinking about the re-education that's necessary and like how we think about not just home birth, but how we think about engaging with our bodies, right? How we sort of know how to navigate and learn how to navigate through systems, whether that is the hospital or the medical office, or how to even sort of know what it is that we need. And so I'm thinking back on sort of on the flip side of that, thinking about I know Kimberly and Dr. Nicholas, you all are sort of responsible for training up, right, emerging sort of birth workers and practitioners. Dr. Gaines, you just finished your doctorate. And so I'm just curious thinking about your own education, right, and thinking about what does it look like kind of coming through a program, right? What kind of learning or what kind of sort of lessons are kind of being imparted into students about, the kind of care needed to serve families of color, right? Especially thinking about the higher risks that they are navigating through hospitals and medical spaces. So I would love to hear from you as someone who, again, congratulations, just finished your program. What were you sort of taught in terms of how to approach working with low-income communities, working with communities of color?
So actually my first master's degree is at UCLA, and I have a master's degree in African American studies.
Yeah.
And so I study structural inequalities in minority communities, specifically around access to healthcare facilities and their roles in the communities. So I had an underlying background already started, and then as I moved up into my education. But one of the things that I've learned is that we need more. In being in nursing school, and as nurses, we spend a lot of time with our patients.
Yeah.
And a lot of these things that I have learned in my work with regards to breastfeeding, kangaroo care in the NICU, not separating mom and baby when after birth. A lot of these things I've learned in my experience in doing research, but a lot of this, I think a lot of these aspects can be learned within school. So we have a good foundation and we have a good understanding. And that's for physicians, that's for doctors, for mid-levels, really taking that piece of education and really using that to move out into when you're within practice. And as our role, when we educate ourselves, our role is to educate other people and take what we've learned and make an impact and make a strong impact. And so if you're not getting that foundational learning, how are you going to be placed in that position to be able to be impactful? So that's what I'm trying to do. So everything from, I'm currently in school right now, finishing up another program, and I'm taking a lot of these things and I'm saying, what can I do as a nurse, as an African American woman, to be able to make an impact and take my knowledge and share that? And this is something that I do with my staff, I do with my nursing staff, I do with my MA staff. Just really sharing my knowledge and really, having them understand a different perspective that they may not otherwise have.
And Dr. Nicholas, I'd love to hear from you because I know that we're going to talk to Kimberly about the Birthing People Foundation. This will come up. So Dr. Nicholas, I'd love to hear from you thinking about building up new training models and like teaching this sort of emerging younger sort of generation who's coming up behind you in the sort of obstetrics and gynecology field. What have been some of the biggest lessons, or what are some of the biggest things that you're trying to make sure that this next generation understands before they start working with and on patients? What are some of the things? I know there's a long list, but what maybe stands out to you, one or two things?
Well, one thing that's very important, I believe, for all learners to understand when dealing with women of color, Black women and brown women, is historically how we have been treated in this healthcare system. How a lot of the research and a lot of the practices that have been developed have really been perhaps developed at our expense. There's been a lot of things that have occurred historically that has not been really articulated and communicated to our learners, which really gives us a foundation and understanding and a framework with regards to how we feel about the healthcare system. That really helps to explain the fear, the mistrust, and just the general feeling of not being heard that historically has been the practice within healthcare settings. So I think one of the things I try to do with my young learners is give them education, give them history, let them know about the various studies that have been done to Black and brown people over the years, and why this has really caused us to have a great skepticism in regards to perhaps participating in research. It has enabled us to really have a fear in regards to being not really appreciated when we start articulating issues about pain, because some of the research that had been done with certain surgical procedures had been done on women of color without any anesthesia. So there was this notion that women of color can sustain pain more than white women, which is obviously a mistruth. So there's a lot of things that have been perpetuated through time, through our culture, that needs to really be dispelled and set aside. So education is one. And then modeling, allow my students to see how I interact with my patients and how I try to listen and respond. When the patient comes in to see me, it shouldn't be my agenda. it should be their agenda. And then once they can communicate what their expectation is as they come in for the visit, then we can try to integrate the kind of things in the visit that's going to enable us to really provide them care. And then having compassion and understanding and empathy, where patients, if they're late for appointments, there's reason maybe they're late. Maybe they had to take several buses to get to work. Maybe they had a lot of other issues. Maybe they're working 2 or 3 jobs, childcare issues. All these kind of things are really very reflective of life for women of color here in this country. And we're talking about many of us being part of that essential worker profile. Yes. And that's very, very intimately correlative to the number of cases of COVID that we see. So there's all kinds of things that I want my students and my learners to keep their eyes open and stay aware, be a part of the social justice movement, because as a physician leader, we should be a strong and loud voice that should demand to be heard.
Absolutely. I think this is a great time to talk a little bit about the work that you're shaping up and leading at the Birthing People Foundation, Kimberly, when Dr. Nicholas is talking about sort of the historical inequities, right? The historical trauma that, clearly many Black folks, Black birthing people have experienced, but also thinking about Native, right, birthing people, thinking about Latinx folks, right, thinking about immigrants coming back and forth to the border. And, we've seen recent news in recent weeks about how many women, right, in ICE sort of detainment are experiencing, right, just trauma once again, right? And so when I think about that, I also think about, on the flip side, the ancestral traditions that also sustained Black communities, that sustained many communities when Black people weren't even allowed in hospitals. So I think about midwives, I think about the granny midwives, I think about the doulas. And so I'm wondering, I know there's so many probably important lessons that you're trying to share with your next generation of birth workers. What would you say are some top things that you're just hoping that, if you leave with nothing else, right, coming through the Birthing People Foundation, what do you want that emerging class of birth workers to know and to really sort of share with their clients when they go out into the world?
Such a great question. Allegra and I created the Birthing People Foundation as we sat at a conference in 2017, the Midwives Alliance of North America conference. It was held in LA. And we, again, were sitting at a conference with lots of sessions about disparities, mortality, more mortality, morbidity, suicide. Every session was sharing very important information. But what struck us is that we heard no solutions. And we decided at that conference, at the closing event, that we had the training and the knowledge and the skills and the experience to start to create some solutions for our community. And one of the solutions we believe would make an impact was training more birth workers of color. So for us, birth workers is a kind of a broad term that encompasses birth doulas, postpartum doulas, lactation consultants. I've been a board certified lactation consultant for 18, 19 years, something like that. And I, can certainly train up more to folks to do what I do. Midwives, mental health folks. One of our board members of the Birthing People Foundation is Dr. Saida Pepra, who's a wonderful Black psychologist that's also a doula and is heading up the Frontline Doula program, which is also an amazing doula program here in LA that provides free doulas. And so we decided that we would just do this, and that we would create a training program that was for us, by us, essentially. We only train BIPOC folks. We focus on BIPOC folks and folks from LGBT community if they identify as BIPOC. And we would only use trainers that were folks of color. So the biggest thing that we wanted our birth worker students to understand is that we have a legacy of birth support. And we have everything within our community to heal our community, that we don't have to go outside to other organizations that don't know anything about our communities and don't speak to our communities and can't hold the space for us. We can do it. We have it within us. And I cannot tell you, I'm getting chills talking about it, because each doula session, each training sessions that we've done, I think we've done 5 cohorts now, or 6 cohorts. has been the most tremendous amount of spiritual, personal, professional growth and healing for every participant. We cry the entire time that we're training. And what I'm very, very, very committed to is teaching our mentees, as Dr. Nicholas said, about our history. Because there's no one else teaching our history about what really went down in this country when we came here. No one else is talking about it, and no one else knows about it. And I'm telling you, doctors and nurses, not y'all, but other medical professionals out there act like that never existed. Yeah. And this is our history. And not only is it, we're experiencing the effects of that now, but I do believe that we have a cellular memory that is being triggered as we, interact in this system about the things that have happened with our ancestors, with our work, with our birth work. Because if we couldn't go into the hospital to deliver our babies, okay, first of all, there wasn't hospitals to deliver babies until maybe the early 1900s. So if we, who was catching the babies then? We were here taking care of our communities, growing our communities, feeding our communities, and we need to get back to that. And we just wanted to show people that we have it all. We just need to tap into it. We need to learn more about our history, and then we just need to allow ourselves to tap into it. And one other thing I want to say that comes up in these trainings is that there's a lot of trauma in our communities that we've all experienced. And I would say, some of the folks that come through the training, they're going to go on and be birth workers, but some folks come through the training and maybe unknowing, they think they're training to become a birth worker, but they actually come to get some healing, and they might go off and do something else, or they might spin off and, it doesn't matter. You don't have to be a birth worker after this training. And I also tell my trainees, this is not the only training you'll take. This is not it. You're going to be learning the rest of your life. I encourage you to take trainings and learn more, and, just never stop learning. So that was our goal. We were lucky enough or blessed enough to get an opportunity to train folks through the Department of Public Health. Los Angeles County Department of Public Health asked us to do a 2 cohorts where we trained specifically African-American folks. At our first training that was held this summer, we also had our first male doula trainee, and he was a magnificent doula. He was wonderful. Just to have that positive male energy in our cohort was fantastic. We did it all virtual, and the Department of Public Health has a really real strong commitment to kind of addressing maternal mortality in African American communities. So the AIM Doula Project funded it, and all those folks got to take that training for free. And they just jumped into the work when this training was done. Folks have, gotten their doula programs off the ground. We have one woman that her specialty is NICU, because she was a mom that had 3 NICU babies. So she specializes in being a doula for families that are dealing with or going to have a NICU situation. We have another woman that trained who works in the AIDS community, is an HIV positive person, and wants to focus her energies on supporting HIV positive pregnant individuals. And so what I see is this huge, acceptance or taking on of this ancestral knowledge being passed down through these young folks. And one other thing I want to say is that we have folks from all ages taking our trainings, but we have so many young folks that are very clear about what they want to do in the world. I feel so positive for the future, because can't tell you how many 21, 22, 23-year-olds I have that are like, this is what I want to do. And they're doing it. So I feel really excited about the work we're doing. And Birthing People Foundation we were able to fundraise to get our space so that we can build out our birth center. And that's a whole nother story.
Wow. So you guys know that you have to follow up and go on the website to learn more and keep up with all the amazing work that they're doing. Kimberly and Allegra are doing, even beyond, obviously, this conversation. I want to start winding down so we can get to some Q&A, because I see we've got about 8 questions. I can't wait to see what they are. And Dr. Gaines, I'd love for you to sort of, you don't mind starting with us, and we can kind of go around again. This is a year, I think, where, for many of you all doing this work, you have probably already been in a state of radically reimagining what systems of care can look like, right? That actually support, empower, affirm, you know, Black, Latinx, Native, queer folks of color who decide to give birth. You've already been thinking about how to recreate spaces that are more equitable, more accessible, thinking about all these things, right? Or else we wouldn't be here today. And so now that, like, as a country, whether people choose to reckon with it or not, we're all kind of being forced to ask, what is the type of future we want to see? What is the type of future we want to participate in building up, right? Where immigrant, queer, trans, disabled women and children's lives do in fact matter, right? Alongside, and of course, Black lives mattering as well. And so when you think about this new world that you all are slowly but steadily, surely helping to build, right, with, you know, new systems and new opportunities, what does it look like, right, for families of color in the future when you're like, this is what I can't wait to see? And maybe it's a space, maybe there's a certain feeling that comes about when you think about the future, but what do you envision for the future, right, for birthing families of color?
That's a great question. So first I wanted just to highlight that the data, right? And so we all know the statistics in terms of African-American mothers are dying at 3 times the rate of non-Hispanic white mothers, and infants are born to African-American mothers are dying at twice the rate of infants born to non-Hispanic white mothers. And so this holds true across educational levels, socioeconomic status, and other women of color. And specifically looking at African-American women of all backgrounds, right. They're experiencing racial and gender discrimination. Kimberly Crenshaw, she is actually an amazing critical race theorist and a law professor, and she coined the term intersectionality almost 30 years ago. And this is where your race and your gender intersect to promote either discrimination or privilege. So for African American women, their race and gender have converged to create a marker of discrimination. And so there's this growing body of research that's actually been proven that the stress induced by this discrimination plays a significant role in the maternal and infant mortality. So the theory is that this constant repeated exposure to discrimination and insult can have stress-related, what they call weathering effect on African Americans' bodies, producing poor pregnancy results and infant death. So this has everything to do with the lived experience of what it is to be a Black woman in America. So where do we go from there? What are some things that we can do to improve their space and to let them have more of a voice in our healthcare systems? So first of all, I think most people know that we want this to be a movement and not a moment. We want people to be able to seize this opportunity and make actionable changes and put the right people in the place to be able to make those changes. People need to be held accountable for their actions, and BIPOC people need to be at the forefront of making these decisions. Mm-hmm. And we need everybody's attention to do this. This is not just for people of color. This is everybody. Everybody has to participate and be part of this movement to really look at how we can make actionable changes. We talk about it, but how are we making actionable changes? Let's hold our elected officials accountable. Let's put pressure on those in power to act. And so what I envision is that we take this opportunity. We know these disparities have happened a long time ago. It's at the forefront right now. Let's look at what we can do as a society to make things better. We need to. We have a problem with infant and maternal mortality here in the United States. Mm-hmm. And it's a huge problem. And so we really need to start looking at viable solutions and get everybody on board. This is not my problem. This is not healthcare. This is everybody's problem. And so we really need to make sure that we have everyone's support and really start making some actionable changes about some of these issues.
Absolutely. Dr. Nicholas, what does the future for families of color look like for you when you think about building a better world where they are front and center and have full agency over their bodies and their decision on how and if and when to give birth? What does that look like for you? What changes?
Well, it looks like to me, I could imagine this truly being a nation that has equal opportunity for all. And before we even start to thinking in terms of a society that can enable equal opportunity for all, we have to really take a critical look at what's happening right here. And what we're talking about, what Dr. Gaines and Kimberly talking about, is the structural and systemic forms of racism in this country that have to be aggressively addressed with intentionality, because what that does, it pours out into all different areas as it relates to economic opportunities, housing. Healthcare is just one component of the big picture. Education, all of those things. We have to tackle this bear at all levels, making our authority figures and elected figures responsible and accountable. Yes, that's true, but that carries over into other realms of influence in our churches, other people that we look to guide us and give us support. Everybody has to be part of the solution for us to move this mountain and really make a change. And I really laud Kimberly, what she's doing in regards to all the things that are there in the community and looking for that sense of empowerment to make a change. But I think that we have to hold people accountable. There is a moral obligation that must be met in this country to allow everybody to have access to healthcare that should not be perceived as a privilege. It is a right. And until we start really making certain that there's a general understanding and appreciation of all these things, it's going to be a very, very difficult road for us to travel. The statistics that Dr. Gaines was talking about is just extremely sobering, because the mortality, infant mortality, maternal mortality should never be at the realm it is here in this country. And if you take other countries that don't have the resources, that they don't have the financial wherewithal and wealth as we have here, they have better statistics than we do. If a woman comes from an upper middle class African-American family, why is she at a greater risk of having a near-miss event or perhaps dying in childbearing as compared to a white woman who may be impoverished with low education?
Right.
The statistics are showing that. So what is the difference? It has to be the racism issue. That's the factor. And, those are the facts. Those are hard facts for people to understand and to accept. But until we get in the room, have those hard conversations, we're not going to be able to move forward. We're not be able to go to that place of healing and to make a more perfect place for all of us to enjoy.
I'm so happy you said that racism, not race, right, as the
That's right.
main and leading contributing factor to the rates of high infant mortality, high
That's right.
mortality. I'm happy that you mentioned that. Kimberly, what are your final thoughts when you think about the kind of future that you all are working on tirelessly? Like, what do you see, right? What does it look like when you think about the kind of future that families of color deserve when it comes to birthing?
Well, that's such a big question. I love everything that Dr. Gaines and Dr. Nicholas shared. It's all so important. I guess for me, one of the people that I really admire is Jenny Joseph. I don't know if any of you know who she is, but if you don't, you need to know who she is. She is the founder of the Common Sense Childbirth in Florida. I think she's in the Fort Lauderdale area. And she's a midwife. She's a British trained midwife who came here, and she's been practicing for over 30 something years. And she has been really at the forefront of tackling disparities in her work by creating more access. And she really got to really pick apart and understand how the system itself was set up to keep folks from having access, whether that was on purpose or not. But she figured it out, and she really took it apart to figure out, what do families have to go through to get into care in Florida? And by understanding the barriers that they were facing and tackling those barriers in her own organization, she was able to, working with a population that may or may not have been low income, they were all the things, and they were people of color. They didn't have any of those disparities in her care. Those kind of disparities that we show up and try to attach to Black and brown folks and say, well, you're Black and brown, so these things are going to happen to you, which I don't believe. She tackled the systemic challenges that kept people from getting care. And her model is just such an inspiration to me. She actually just became the first Black midwifery school in the United States that is a NARM approved school, so that folks can go and learn with her and actually get licensed as a care provider, as a licensed midwife. And I almost wish I could do school all over again so I could do it with her. But that said, I think that what I would like to see is more of us doing this work in an aligned way where we understand our past and we understand where we are now and we understand where we want to go in the future. I think that we need more soldiers. We need more folks. We need 100 Dr. Gaines, at least. We need at least 250 Dr. Nicholases, and at my point in my life, I'm thinking about legacy. Yeah. What do I want to leave? And so I'm very excited. I think that as one of my friends, Dr. Shafia Monroe says, we need a midwife, a birth center, and a doula on every corner, right? We need to have more of us that so that when we're coming in contact with us, that we can kind of cross out the racism piece. Let's just get that off the table. And let's be open. I would like to see more folks thinking outside of the box and either creating new systems that work better or reimagining the systems that are here now, reconfiguring them, changing them. I sometimes think that the systems that we have now are so big and so huge and so entrenched that to do the work to pick it apart and put it back together again the way it should be is going to take us another 150 years. And then it will be outdated by the time we get there. So I really am interested in folks that are thinking out of the box, working within, alongside, beside, and outside of the system to create better outcomes, better experiences, more options, more access for all families.
Well, I am so thankful for all of you sort of sharing these ideas, and the fact that they overlap shows you like how real it is, right? And but also how possible it can be as well to do this work in collaboration, right, with other organizations, other individuals of like mind who want to see better results and better outcomes for families of color. And so I'm really excited to maybe dive into some of these questions from the audience. I'd say maybe I'll ask a question and just have one of you answer, whoever kind of feels the spirit and wants to sort of answer first. We've got a question from Mary Titus. Can you focus on mental health regarding postpartum depression and how that may be unique to our mommies of color? That's a broad topic. So maybe, I think Kimberly, you actually raised this point. It doesn't have to be you, but maybe just sort of talk about maybe some of the, I think sort of not symptoms, but things that folks can identify, right? If they're in partnership or families with someone who just gave birth, what are things they can identify, and maybe what are resources? So let's kind of think about, solutions too, so folks can take that with them when they leave this conversation. So I don't know who wants to go on that one. Postpartum depression, identifying.
I'm happy to answer that quickly. One of the things I would say is if you've had a history of depression at any time in your life or anxiety, you're more likely to experience postpartum depression and anxiety post-birth. So even just knowing yourself, or if you've had a trauma or any of the other kind of markers for, adverse childhood experiences, for examples, be honest with yourself. Look at that. Don't think this is something you can sweep under the rug. Right. Get help and get support. And I think in these COVID times in particular, I pretty much think that every person, especially every parent or parent-to-be, needs to know or have a good therapist on speed dial, or actually just have a therapist. Like we don't often know when we might need to reach out. And sometimes when we're in a crisis mode, then we're trying to scramble to find the resources. So I encourage people, find your resources almost before you need it. Do those mental health checkups on yourself. Kind of take that time to really to remember that your mental health is just as important as your physical, emotional, spiritual health. It really is. And so I think, give yourself permission to get more support. And in terms of resources for postpartum, there's a really great organization called Postpartum Support International. And they're wonderful. They offer free support. They can connect you with resources and those sorts of things. Also, I would say it's important to build a strong relationship with the care providers that you choose. Okay. And so if you are having challenges, or if you're seeing your partner having challenges, that's when you're supposed to call the care provider. And it's not incumbent upon the person who's feeling depressed. It's those family members. It's the partners. It's the boyfriends, the girlfriends. My partner, something is not right. I need to reach out to our healthcare professional and get help. So help is available, but sometimes we kind of spin around in terms of like actually making the decision to get help. So that's all I'll say on that. But help is here, and we should all be seeking it.
Gabrielle, if I could just add a little bit to that too, Kim, you know, what we do in our office, and not only myself, but also the staff that works with me, are trained to do screening mechanisms for depression. And we do that with all our prenatal patients, even from the first visit. And we make sure that we rescreen and make contact with the patient shortly after delivery. This also takes place in the hospital with rescreening for depression. And what we try to do is not allow patients or families to feel stigmatized or believe it's something that's just an imagination. It can be a very real situation that can lead to a very tragic outcome if not appropriately addressed.
Right.
Can I chime in just a little piece of this too? Sorry. So at Venice Family Clinic, we've so a lot of facilities have had to think about some different processes or products that they've had to eliminate because of COVID or reduce. And so we did recognize that mental health is extremely important. And so we have done some telemedicine around behavioral health, hired on extra staff to be able to address these concerns because depression has gone up. And so we want to make sure that we are addressing some of these issues and having support for our staff and our prenatal moms and everyone else who's coming into the facility. And I'm doing some research on therapy and looking for therapists that look like me. And there's a new app that just came out last month called Ayana, and they actually pair up people of color with therapists who are of color. And there's been some research about like, what does that look like and how that's more impactful. And so just, thinking about that and how we can create these spaces and have more support.
One last question that I think Dr. Gaines was for you. So I'd love to hear your thoughts on this. There is a nurse there are a few nurses in the audience. Shout out to all the nurses with us today. This nurse is a nurse of color in the L&D unit, labor and delivery unit for those out there. And they don't have a lot of POC staff around them. And so how can this nurse attempt to show the implicit bias within her work environment, right? Like, how do you, I guess, speak up, like as a nurse, what would be like a piece of advice that you would have for this nurse or sort of emerging nurses? Like, how do they speak up? How do they call out when something is wrong or just deeply racist? Or maybe it's not so overtly racist, but something's off here. What would you encourage them to do?
I think it's important that individual shouldn't go at it alone. This is not just something that's placed on this individual. The facility in general should be concerned about this. And I know now, in some respect, because it's, because of everything that's happened with COVID, because of everything that's happened with Black Lives Matters and issues around race and ethnicity and gender, a lot more organizations are having more anti-racist curriculum and thinking about how they can do more to train staff on implicit bias. Training's not enough. I think it's a start, but I think organizations really have to take ownership of this and really look at what are we doing that's racist? What are we doing what can we do to improve our practices and our policies so that one individual doesn't feel like they have to be that one person to go at it alone. It's really important for organizations, community members, everyone should be on board with this and really start looking at what are they doing to improve their outcomes for their patients. What are some structural things that they may have to address and may have to look at in order to make improvements, and get everybody involved, the nurses, the whole team. When, myself as a nurse, I was always involved, try to get involved in everything. And when something that I didn't feel was right, I was very vocal about it and really getting, whoever the support is that you can get them on board with you. Absolutely. And really start talking about this as a system-wide issue rather than you yourself alone being that one individual to have to stand up for this. We all need to be accountable. Like everyone said, we all have to be accountable for this.
So happy you said that. and I'm just because I like to push it right close to the edge. If I could have everyone, we've got one sort of attendee, Emmanuel Macias, asking one book that each of you would recommend to learn more about this topic, birthing families of color, the work that's being done. Can each of you maybe go around, if you have a book that comes to mind, just sort of say the name and author if you have it. If not, maybe just one of you. I think that could be something helpful for folks to take with them as they leave this space and continue this learning and trying to do better by all of us, honestly. Dr. Nicholas, Kimberly?
Well, there's a book entitled Medical Apartheid, and it gives a good perspective in regards to the experience here in the medical system. I believe it's Harriet Washington. I think that's the author on that. I would have to check on that. That's one that comes to mind. But there's a long list of books that are available to really give a good perspective in regards to the healthcare system. And that's one that came to mind. We're reading as a common book, How to Be Anti-Racist. And that's also a very good read.
Good learning. Anyone else want to chime in before we wrap up for today?
Oh, go ahead. Go ahead.
No, you go ahead, Kennetha. I'm sure you're way more well-read than I am. Go ahead.
No. Everyone's talking about White Fragility by Raman D'Angelo. And then also there's a book called Me and White Supremacy. And then anything by Ta-Nehisi Coates. He's amazing. I've been reading a lot on reparations and his thoughts with regards to that. So those are, and there's so much right now. There's so many really good books that have been around, but then just because of everything that's going on right now, they're really coming to the forefront.
Yeah.
So there's so much reading that people can participate in.
Yeah, I just wanted to say I'm looking forward. I just wish I have a wish list of books I wish were written. I was struck by when I was doing my midwifery training that the only books and reference materials I could use are written by white folks. And I know that we have a huge history of Black midwifery in this country. And I'm just, wishing for the books I could read, and wondering why we don't have any of our own reference materials. That's my big question. And the other book that I would like to read when it's written, because I keep pushing, there's a fantastic midwife, Dr. Michelle Drew out of Delaware, and I'm shouting her out because she is really a curator and historian in terms of learning the history of our fantastic tradition of how we care for birthing families in this country. And she just has all the tea on everybody. She goes to the libraries, does the research, pulls the documents. So I'm just waiting for her book to come out. So Michelle Drew, hurry up and write that book.
Got to note it for sure. And I'll add Killing the Black Body by Dorothy Roberts to that. But so obviously you can tell there is a lot to sort of take with you as you leave this space, leave this conversation. The learning really doesn't stop. And I thank you all for allowing me a space to kind of have a conversation with the three of you that doesn't solely focus on death solely, because I know that sometimes that's just solely the narrative, but you all are doing some really incredible and innovative and collaborative work that I think also needs to be highlighted, if not even more so than the headlines we hear about, right? Black women are 3 to 4 times more likely, and the same for Native women. And we know those statistics, and I want us to know them, but I also want us to know the work that's being done. And I think you guys have done such a beautiful job in sharing with our attendees today. We had, I think, up to like almost 140 folks who are with us today who are going to take that knowledge back, talk about the work that you all are building, the spaces you all are creating, the re-education you guys are literally putting into practice. And I just get so excited thinking about it. You're helping to build the future so that families of color, birthing families of color, can feel safe, can feel seen, affirmed, and have this, as I think, Kimberly, you say so beautiful, when I think when we first met, have a joyful and sacred birth experience, because we all deserve that. So thank you all for what you're doing, Dr. Gaines, Kimberly, and Dr. Nicholas. Thank you all so much. Thank you to the Bannis Family Clinic for allowing us to have this space to come together, to share, and to learn from each other and with each other. And thank you to all the attendees for joining us for the 4th installment of the series. That has been such an incredible conversation as we all try to make sense of what is this new normal. So thank you all so much. Find more details about the speakers on the website, and look out for more from Bannis Family Clinic in the days to come. Thank you all. Take care, be safe, and be well.
Thank you.
Thank you.